So welcome everyone to Holistic Holiday at Sea's Q&A with Dr. Yoav Suprun. We are so thrilled to have you joining us. And today we're going to just be discussing questions that were submitted prior to the webinar. And then we're going to open to all of you who are joining us today so that you can add your questions to the chat or to the question and answer section of Zoom. So as we go along, if you have questions, please feel free to submit them, and then I will read them so everyone can hear, and Dr. Suprun will answer them. So for those of you who don't know, Dr. Suprun was an enormously popular part of our cruise this year, the Holistic Holiday at Sea, and we are so grateful that he's agreed to take time today to share his knowledge and experience. He's an authority on the McKenzie method of self-treatment for common discomforts and pain in the neck, back, and extremities. And we're really honored to have him here. So welcome, Dr. Suprun.
Thank you, Sarah. And hi, everyone. Those of you who are quarantined at home, I hope you are using some of the tips that was given to you in my in the recorded video we did. So welcome. I'm right here in my office in Miami Beach, and if there's anyone on the talk that hasn't met me or hasn't listened to the webinar and was just told to join, I'll give a 2-minute brief introduction of who I am. Started my career in 1995 as a personal trainer in New York City. Unfortunately, it didn't take me a long time to become a trainer, and I injured a couple of my clients in the process. Didn't know what I didn't know. Got better as I went to NYU. I did my doctorate in physical therapy, went to work for one of my professors, and slowly found my way through continuing education courses into the McKenzie method, a method that was invented by Robin McKenzie. He's the man behind it. Basically, in one sentence, the secret to adjust your own neck and back, your hip, knee, or ankle, your shoulder, your elbow, your wrist can be adjusted. Sometimes you do it and pain goes away. Sometimes you get up from sitting position, your back is stiff, you push into it, you do something, you hear maybe a click, you walk around, it goes away. Well, there's a method to do that. Sometimes you wake up in the morning or during the day and your neck is stiff, and there's days that it's there and days that it's not, and you're trying to resolve it, and there's a way to resolve it fairly quickly if you know the rules of movement in a specific direction. So that's what I did. I did a few talks on the cruise, and I've seen patients on the cruise as well. Unfortunately, I couldn't see all of you, so I'm happy you're joining us here. And let's start with some Q&A session. We got a couple of questions that came in the past few days, and I'll be happy to answer them. And feel free to type them into your chat, and Sarah will read them to me, and hopefully I'll be able to answer all of them. All right, so we can start.
Great. So the first question we have is a great segue based on what you were just sharing about your time on the cruise. It comes from Carla, and she'd like to know, when we were all on the cruise, you mentioned during one of your lectures that as a personal trainer, there were exercises that you instructed clients to do that were then detrimental. Is there some place where they can find a list of those exercises that they should avoid, or could you share some of that now?
So, okay, great question. Hi, Carla. First of all, there is no list because every person has to go through an assessment process to know what are the right movements that he or she should do. But in general, when someone has lower back pain, in those days, I would tell people to stretch forward, which always feels good, or to lie on their bed. Let me lower the camera here. To lie on their bed and hug their knees to the chest, which again, always feels good. I would encourage people to do things like, posterior pelvic tilt. I would give them crunches. But what I didn't know is that when someone has lower back pain, the majority, not all, but the majority of people that have lower back pain don't need exercises in this direction while they're experiencing pain. Majority of people need exercises that move in that direction, things that open them up and not close them down. So when someone says the following, I watched a movie, I sat for breakfast, lunch, dinner, I got up, my back was stiff. The first couple of steps, I felt pain radiating maybe into the buttock, maybe down the leg. I walked around the house, it went away. Or I left my house, I went for a walk, the pain went away. When someone says that, as a trainer in those days, I didn't know that an exercise, for example, such as tricep kickbacks, where I bend forward, or giving someone flies holding dumbbells, is a detrimental exercise. Because what the person is telling me in the history is that flexion, sitting, or bending activities hurt my back. What I didn't know, and again, you don't know what you don't know, is that during the workout, I shouldn't provide them with exercises that involve bending, especially not with weights. Because all I was doing is I was loading their spine in the same direction they were telling me that is hurting them. Now, as those of you who can remember, the spine has an S curvature. If you are maintaining the S in general, during the day, during your life, if you're keeping your S, your body is getting the optimal output from the nervous system. We have the nerves coming out of the spine here. These are the vertebrae. In between the vertebrae, there's the discs. Here we have muscles, ligaments. We have the organs here. We have the kidneys. We have the lungs up here. And so everything receives power from the nervous system. We know that. The spine is very important in controlling everything, basically everything as far as sensation and movement, everything we do. We want to keep the spine happy. When someone tells me that sitting or bending or reaching to take water out of the refrigerator cause them to feel back pain, or shaving their legs, or sitting on a bike or on a kayak, and when they get up, they feel that transitional stiffness, I would encourage you in those days not to do exercises. First of all, I would encourage you to get an assessment. And before we even go there, I should have said that everything I recommend here is general recommendation, and you should absolutely either see me, if you have a problem, see me through Holistic Holiday at Sea link to this talk, or get a solid assessment by a McKenzie trained therapist where you live. But in general, if you're experiencing those sensations, I would encourage you not to spin on those days, not to do crunches on those days, even not to go into a child's pose. And many people doing it, but when you are getting to that S and you walk around, you transition from C to S, from C to S. You do not want to do exercises that will promote further C. What are the exercises, Carla? Crunches, child's pose, tricep kickbacks, using maybe possibly kettlebells without knowing the right mechanics of how to move. Squats that are not you're not maintaining the hollow in the lower back and you're doing that. Certain mat Pilates can be detrimental, such as the 100, where you're lying on your back and pumping the arm. So, you know, again, I didn't know what I didn't know, and I thought strengthening my client's core will help them keep their back safe. And you've heard it for so many years, and yet so many of your friends, you and your friends, are still experiencing back pain and neck pain, although you have strengthened your core for 20, 30, 40 years. So what is the reason? The reason is the public was never educated enough in taking care of their own spine. People were told you need to see someone. And if you know how to take care of your spine, and for that you need to have a solid assessment, if you know how to keep your spine, the joints in your spine, and the structures, and many structures can be the pain generators. It could be the facet joints that are back here. it could be the disc, you can have a sprained ligament, you can have a muscle issue, you can have, God forbid, something sinister growing there. But when we do an assessment, we are asking all these questions and we're finding what's called a directional preference. And based on that, my clients do specific exercise to heal the problem. Once the problem has healed, then you can go back to doing exercises that involve bending. Just like when you have a cut on the back of your knuckle, the one thing you're not going to do is bend to open the cut. So you want to let the cut heal. And if you think of a cut on the back of a knuckle and a cut that generates pain in the back, they're very similar. So I don't want to do activities that bend me forward. I want to probably do activities that extend my spine. And there's certain exercise to do and certain to avoid, and to know exactly which one you need to do. A good solid assessment is recommended.
Wonderful. And I think this next question relates directly to what you were just discussing. It comes from Mary, and her question was, you have mentioned several exercises that are helpful daily. Could you suggest a general preventative exercise routine to do each morning? But of course, what you just shared is a lot of it is personalized. So what is your feedback about that issue?
Okay, so what do I do on a daily basis for prevention? Let's put it on me. What do I think is really important to avoid, first of all, aging stuck forward towards the cane or towards the walker, to maintain good alignment, to maintain that S curvature? So first thing I do when I wake up in the morning, let me lower the camera down so people can see it. I sit on my bed and I arch my lower back forward and I let go. And I do 10, 15 repetitions. And the first 5 to 10 could be a little stiff, but I'm not afraid of that stiffness. I know the stiffness is of mechanical origin. And I go into it and out of it, and into it and out of it. And I do that. Then I get up, go to the bathroom, do my things. As I'm preparing my coffee in the morning and throughout the day, I would say on an average day, I probably do anywhere from 40 to 50 repetitions where my hands are in the small of the back. And again, some of you, as you do that, will experience pain that might make you worse. You should have an assessment first to make sure this is appropriate for you. This is what I'm doing. Hands in the small of the back, legs, feet are shoulder width apart, and I am bending. Let's do it from a profile. And I'm bending. The first 5 in the morning are fairly stiff. Within 2 to 3 hours later, I start to notice, or as I'm doing more repetition, I can see further of the ceiling. I can go further back. I'll do that, for example, also before I get on a plane. If I fly to California for 5 hours from Miami, I will never sit by the gate. You will never catch me, not once, catch me sitting by the gate. I will stand by the gate because I know I'm going to be sitting on the plane. So it makes no sense to sit by the gate and then sit on the plane. Remember, we're sitting way too much. So I will stand and again, check for stiffness. If I detect stiffness, if I find that all of a sudden my ability to bend backwards becomes more difficult, I'll do more repetitions to loosen up that stiffness. That's as far as the lower back. What do I do in terms of my neck, my own neck? Those of you remember, I had 8 months of neck pain that got resolved in one course that I did in New York, and then I did part A, part B, McKenzie part A, part B, and in part B, which is the cervical spine, I got resolved, and I had pain on the left side of my neck, and I kept stretching to the right. Long story short, what I do for my neck is what's called retraction, and I would say on a daily basis, I do about anywhere from 50 to 70 repetitions of retractions, probably more. When I drive, I push my head into the back of the the headrest in the car. If I watch television, I make sure I don't lean back with my head forward. I keep my spine and my head in one alignment. I'll lean back and have my head aligned. Television is high up on the wall. It's not sitting on a cabinet down low. So I do retractions of the neck. Think of a really ugly person coming to kiss you. As you remember, retraction of the neck. It's not looking down, it's moving the head back in. Let me move closer to the camera so you can see the exact execution of retraction. So I am pulling my head straight back. You have to sit straight to be able to do it. If you slouch, I can still talk to you. I'm moving my head and I'm reaching end range fairly quickly. You have to sit as straight as you can, as erect as you can, and now retract your head back and let go. And again, the first 5, 10, 15 repetitions, for some of you, you're gonna experience some pain, but remember, there is one phenomena that you must remember, that as you're moving, if you're experiencing, and you can read more about that phenomena in either the Treat Your Own Back or Treat Your Own Neck, there is a phenomena called centralization. Centralization, those of you remember, is the movement of the pain from a distal, from a far away, whether it's down the arm or down the leg, to the center of the neck. So I'll show it right here first on the neck. So the worst is this person here, where the symptoms are going, you have a pinched nerve or pain that is radiating all the way down. And as you move, if you're starting to feel the pain moving up, where your forearm is getting better, but your shoulder is getting worse, keep doing your retraction. Or your shoulder gets better, but now you're feeling pain in the neck, do some more. And the same thing applies to the lumbar spine. So if you feel sciatica, which is nerve pain that you experience down the leg, like so, and it can go in different directions. It can go on the side, it can go in the back. And as you're moving, as you're doing those extensions, whether it's extensions in standing or extension in lying, these are extension in lying, for example. Again, one more time, you gotta be assessed to make sure this is appropriate for you. As you're doing it, if your symptoms are moving out of the leg to the back, you need to do more of them. So to summarize, what I do on a daily basis, I do the slouch over correct, I wake up my spine first thing in the morning. I move my head a little back at the top, I let go. That's one. I check throughout the day that I'm not developing stiffness. Think about it, very logical. If you check once or twice a day, your ability to bend backwards and you're not stiff, why would you ever age stuck forward with, and then people come to see me in their 70s, 80s, 90s, where they lost the ability to go there. But if you check it every day, you should maintain flexibility in that direction. Remember, 3,500 times a day we bend forward. Everything we do in life, because our eyes are in front of our skull, everything we do in life involves bending forward. Unfortunately, in the gym, I also strengthened a lot of my clients' core by putting them in machines that bend them forward, or gave them exercises that bend them forward. So if you keep balancing between flexion and extension, you should be good. That's the lumbar spine. As far as the neck, retraction of the neck is something I do on a daily basis. And there's one more movement that I do on a daily basis, and that is extension of the neck, with that little bit of a wiggle at the end of the motion. Retraction, extension. Why do I extend my neck? And a lot of people are afraid of it. And I have patients who their doctors told them never to do that, which is absolutely ridiculous, because what is it? Okay, all day long to look at your phone down, but it's not okay to look up? Why do doctors say it often to patients? Because it hurts to look up. If you never did it, it will hurt you. Hence, you need to have an assessment, but hurt doesn't mean harm. So if I start to move properly in this direction, and then I slowly start to go here, before even adding that nose nod, I have patients who do it over a couple of sessions, and they go from here to the following session, they just extend the neck. They're just going to the pain and out of the pain, to the pain, out of the pain, very slowly until they can generate that end range. Then often the pain subsides, range of motion improves, mechanics, the noises so many of you are feeling in the neck, those noises are gone. Because again, the mechanics of the neck requires balance. We can't all the time protrude our head and look at a monitor and look at our phones without moving the head in the opposite direction. So these are what I do for myself on a daily basis.
Great, thank you so much. That was very valuable. The next question comes from Mary Davis, and it's a two-part question. First, by doing exercises for correct posture, can or will the disc increase thickness? And also, can you talk a little bit about loss of height in older age?
Okay, excellent question. So, let me start by saying that the red was that, remember, Mr. Smith, the patient that came to see him in 1956, and Robin sent him to the room, lying on his stomach, and Robin didn't know that the head of the table was elevated, so Mr. Smith laid in extension, and then Mr. Smith actually felt better after lying in his position. His pain moved. We just talked about centralization. His pain moved from the leg to the back, and Robin started to experiment with it. And so the theoretical model was that if Mr. Smith experienced sciatica, which is leg pain that is emanating from the spine, and you feel it in your butt, you feel it in the leg, if that sciatica was coming and going up and going down, there must have been some structure in the spine that is responding to load, meaning there's something there that can be changed as far as pressure on the nerve. So what Robin hypothesized and what his discoveries were, and he focused a lot of his career on a structure named the intervertebral disc, that when you bend forward a lot, or especially if you slouch, if you have 3,500 times a day we bend forward, plus we slouch, and we don't sit properly, his theoretical model was, and here's two vertebrae and a disc, this is a vertebrae, okay, two large model, two vertebrae and a disc. So if you bend forward, inside the disc, there's material that's called the nucleus pulposus. Eventually, Robin theorized that that jelly is migrating towards the nerve and can cause both back pain as well as leg pain. Now, in MRIs, we're seeing people who do not have bulging disc and they're still having pain. So there's controversy around the world as far as the pain generator. Some people think it's the facet joint. Some people think it's their muscles, the ligaments, the disc, leg length discrepancy. You've heard it all, right? So to go back to your question, can you maintain height? If you, in general, we all lose height as we age. So you can say something like so. This is a disc of someone, let's say, at 25. And this person, you can see the height loss here. This is a disc of someone who, let's say, is 85. You can see how the disc over time dehydrates. Unfortunately, the medical community calls this degenerative disc disease. And I have patients coming to my office on a daily basis, being scared, oh, I had an MRI and I have the worst degeneration the doctor has seen. I am bone on bone in my spine, I'm arthritic and I need spine surgery. I asked them a question. Do you have good and bad days? Yes, there are days I can walk, there are days I can get up from the sofa, I'm fine. There's days I can climb stairs, my back doesn't hurt. There's days I can get into underwear in the morning and I feel fine. Days it's terrible. And then comes the interesting question. What happens to your degenerative disc disease on the good days? And people often, when they hear that question, they stare at me. They look and they ask, well, I don't know. Well, yeah, it makes sense. It's still degenerated. You still lost some height. So what could it be? So let me tell you the truth. We all have, at some point, we will develop degenerative disc disease. We will all, at some point, develop fissures, which are cuts inside the disc. I'll show you another model. Inside the disc here, you can see those red lines. These are fissures. These are cuts that are actually allowing this nuclear material to move. Now, these cuts are not painful. They could be if nuclear material goes into them. Just like wrinkles, just like gray hair. It's a normal process of aging. Most of your moms, dads, grandparents, people you know, as they got older, they shrunk. My dad is 91, he shrunk. My mom is 86, she shrunk. We shrink predominantly from the discs in the spine. If you take all those discs and you pull them out, you'll get a nice large cake of those discs. And as we get older, they become thinner. So that's the predominant height loss as far as structure in the body. That's the first structure. But if you maintain good posture, if you extend your spine, it's not that you're going to necessarily maintain, because you can't avoid developing, wrinkles or gray hair. It's part of aging, but you can avoid getting stuck towards the cane or towards the walker if you maintain flexibility in the opposite direction. So I have patients who say to me, Yoav, I gained an inch or half an inch, but it's not really truly taking their disc and adding height to the disc. They just learn to sit properly. They learn to carry themselves upright and not down here when they're working on their computer. And so the more effort you put, and it takes about 3 months to achieve good posture. And if you are inclined to do that, you will notice that your people are commenting and complimenting you that your gait, that your ability to stand up has improved. And so that is an important component to take into account. Don't be alarmed by the fact that you're told, oh, you have, degenerative disc disease. Everyone over 40 has some form of degeneration that started already. But remember, if you have good and bad days, your problem is mechanical. And mechanical problem involves movement and not looking at a structure and being afraid because someone told you, you're bone on bone. The same thing applies to your knees. Anyone that's listening to us right now that's over 60, you get an X-ray, an MRI of your knee, they'll tell you have a bone on bone. Someone will push you to replace your knees. Please do me a favor, and you heard it on the cruise. God gave it to you. Leave your meniscus there. Don't take it out. Don't inject it if you don't have to. Some cases, maybe injection is needed, but don't rush to get an operation unless you had a mechanical assessment first. Especially, please, if you have good and bad days, good and bad weeks, don't rush to have surgery. Get an assessment, a mechanical assessment. You can find, if you Google the McKenzie method, first of all, you can find us in 29 countries, I believe, right now. I might be wrong, maybe it's more. But in the United States, you just put your zip code, you'll be able to find the therapist next to you. Should you be interested in meeting with me next week, this coming week, you'll apply through Holistic Holiday at Sea's website. You'll have the description here after we finish, and we'll be able to do a virtual session to help you.
Excellent. So the next question comes from Leslie. It is, would the McKenzie method work for decades of lower back pain that fluctuates in intensity? It's usually just mild, but a constant aggravation. She's tried many modalities, is this method similar to muscle activation technique? And she's having a little trouble finding a provider in East Cleveland, Ohio. So that's why she's curious about the relationship between the McKenzie method and muscle activation technique.
So the McKenzie method is an assessment first. It's an assessment process. It is not like any other method because it teaches you to take care of yourself. Our average is low. My average in my office is 6 visits. I teach my clients to take care of themselves because remember, it doesn't matter how good I am if you're not with me for 23 hours of the day. You're with me for an hour. If you don't know what to do when you're not with me, things don't hold. And and I learned there's many methods, and you have seen, I'm sure, Leslie, over the years you have strengthened your cores and you stretch your hamstrings, and you may have bought a brace, and maybe you put some lift in your shoes, and maybe you bought an inversion table and you hang. Look, mechanical back pain is something that 80, if not higher, 80% of the population will feel. Now, in your story, you're saying you have constant symptoms, but they fluctuate. I'm interested to know what causes them to fluctuate, what makes you worse and what makes you better. So when I do an assessment, I ask people a lot of questions such as, what happens to you when you sit? Does it matter what chair you're sitting? What is the difference, Leslie, between you watching a movie, sitting on a sofa with a pillow in your lower back, with a small pillow in your lower back like so, versus you watching a movie, Leslie, with your legs on the coffee table like so? And how do you feel the following morning? Same thing applies. Maybe you're in bed. Maybe you're leaning with a few pillows against your headboard, and you're reading a book before you go to bed at night. Pay attention. Right now, I'm in a C. I'm in a strong C curvature. I'm leaning against the headboard, and my butt is forward. I'm in an identical, look, I'm looking towards my toes. As I stand up, I'm looking towards my toes. Take me now and put me in this position. It's the same. People don't connect the two because the television is there. And they, especially now during the pandemic, we're hanging a lot, like so, in this certain situation. And then people go to sleep and they also sleep. And I ask people, how do you feel when you wake up? Most of us sleep with our knees bent. Maybe you have a pillow between your knees. Maybe you were told to put a pillow under your knees if you sleep on your back. But all those, Leslie, are mechanical questions I will ask you. And I will ask you to move multiple times to be able to assess what happens to you when you flex, when you extend, when you glide your hips all the way this way, all the way that way. That gives me a lot of information as far as what are the mechanics that are affecting your spine. How do you feel when you get up from sitting? What happens when you get out of your car? When was last time you had, a week with no pain or minimal pain, where it was maybe 0 to 1 out of 10? All those are questions that I'll also ask you if there's anything sinister. Are you losing weight without trying, which is not a good thing? To lose weight, the common answer when I ask a patient, are you losing weight without trying? The common answer is, I wish. But if someone says I'm losing weight without trying and they have also unremitting night pain, that's usually a sign of something sinister going on in their spine. They actually do need to go get an MRI. They do need to be checked. But the majority of you guys do not experience that. And so I'm a faculty with the McKenzie Institute International. I devoted my whole career to understanding what Robin McKenzie developed. I think his assessment and our assessment is by far the most thorough. And the beauty of this method is, again, it's not the 12, 15, 20 sessions you've had of physical therapy. It's how how much you get educated, how much you get the knowledge, the awareness that when you hang out at home, you apply that knowledge. It doesn't matter if someone puts electric stimulation on your back or does, you know, all the common core exercise, the cat-cow, opposite arm and leg, you know, pelvic raises. We've seen it. I'm sure you've done it in physical therapy, Leslie. What's important is to pay attention to mechanics. What's important is to make sure when you are checking emails, when you sit in front of your laptop, that you have your laptop elevated, not sitting on your desk, that you have a lumbar roll, that you sit properly, that you have a separate keyboard, separate mouse, that you're doing the work like so and not like so. These are the things that even people with chronic pain, I've seen patients with years of pain, and when they started to pay attention to their daily activities, the things they do, the fact that we bend forward underneath the sink. Okay, so, you know, what I would recommend, Leslie, is to pay attention to it. I'll ask you a lot of questions. And if you have a daughter or granddaughter, for example, you're holding her or him only on one hip, that's a problem. If you're not balancing it, there's a lot of things we do that contribute to loads onto the spine. And again, the spine requires balance.
But the next question is from Nabil, and it is, so I found my directional exercise has moved the pain from my leg into my back. Do you have any idea how long it will take for that back pain to also leave?
So usually if you were able to do it, you found your directional preference, which is excellent, Nabil. And then usually a few days is the pain should stay concentrated in the back. In case it starts to go down the leg, you will probably need someone to assist you with a towel in your lower back as you're doing either the press ups, or whether you found it leaning against, doing it freestanding, maybe doing it against the counter will add additional overpressure, and probably a few days, 2 or 3 days, often it starts to disappear from the back. And again, once it's gone from the back for a few days, then it's the right time to start and introduce. I am not saying, I just want everyone to be very aware, I'm not saying that hugging knees to chest or bending forward like so or bending forward like so are bad. These are appropriate, just like when the cut heals, it's appropriate to start bending. So there's a time and a place. First you let the spine heal, and then you start introducing motions in the opposite direction. And a healthy spine is a flexible spine that can both bend and extend. So going back to Nabil's question, keep doing what you're doing, see if within a couple, 2-3 more days, then will be the right time to start introducing motions in the opposite direction. But again, I would highly recommend that you get advice from a trained McKenzie therapist, whether it's a chiropractor, medical doctor, or physical therapist training the method.
Okay, great. Thank you so much. The next question we have comes from Elaine, and it is, are there some exercises we should avoid if you have osteoporosis in the lower back? She wants to strengthen her core, but wants to be careful of that.
Good. Osteoporosis looks like so. Thank you, Elaine. This is a healthy bone. This is an osteoporotic bone. You see the bone become more fragile. I would encourage you, if you have osteoporosis, first of all, to avoid heavy flexion exercises. To be, first of all, you gotta check to see what your vitamin D level, because a lot of people take calcium without realizing the vitamin D actually pushes the calcium into the bones. Assuming your D levels are good, assuming that you're doing everything as far as nutrition that is appropriate, and you want to strengthen your core, I would stick more with planks. I would stick more with exercises that maintain some kind of a neutral spine, not exercises that bend your spine a lot. Because remember, this bone is more fragile, it's more porous than this one. So I would avoid exercises that bend you forward. I would avoid mat Pilates, for example. I would encourage you to do reformer, where you're able to maintain more of a neutral spine. If you have a cough or a sneeze, I would encourage you to get up and start your sneeze from here and end it here, as opposed to doing things that involve a lot of bending. Be careful with activities in the house that involve lifting and twisting. These are the things that could affect someone who has osteoporosis.
Great. So the next question comes from Deborah, and it is, can cervical problems create headaches at the back of the skull on one side?
1,000,000% yes. 1,000,000% yes. Tons of people, ladies and gentlemen, tons of people do not have allergies, do not have issues related to their TMJ. They can have pain that is starting in the neck and is going mechanical headache. It can go to one side only. It can go around the occiput. It can go in the back of the head. It can radiate behind the eye. It can cause sensitivity in the skin. I have patients who have had toothache, ringing in the ear, all from a derangement, from a mechanical obstruction or mechanical malalignment in the joints of their neck. Once we were able to find their directional preference, they got better. I can tell you that a lot of people that are staring at a monitor or looking at their iPads, like so, with their head down, playing cards or doing whatever, or watching TV in bed or reading like so with their neck behind a pillow, or were convinced to purchase their back sleepers and convinced to purchase one of those pillows, contoured pillows that pushes your head forward. Some of those patients wake up in the morning with a headache. They walk around the house, the headache subsides. It comes back sometimes during the day as they're driving. Also, their headrest in the car could be a culprit. So to go back to the question, absolutely yes. And for that, again, you should do an assessment to find out what's your directional preference. And I'll be happy to help with that.
The next question comes from Karen, and it is, I have chronic lower back pain due to a compressed L5, subluxated L4, and my hips are uneven, etc. I'm active, do yoga, walk, stretch. I'm not overweight. I see a chiropractor monthly along with massage. I always have some level of pain in my low back and hips though. Do you have any suggestions?
So my question will be, you're kind of maintaining, you're seeing some therapist, chiropractor, massage therapist, but you're still, and you're not overweight, you're active, but you're still experiencing pain. So often when I see a lot of ladies like you, I listen to their history. I try to take something out for a period of 1 week, maybe 2 weeks. We avoid certain exercises. For example, if you're doing ragdoll in yoga, or if you're doing a lot of child's pose and your back is still hurting, I would encourage you to first obviously get an assessment, but there are certain things in yoga that are wonderful and certain things that you got to take out for a period of time. Remember, when I have a cut on the back of a knuckle, it makes no sense for me to bend my knuckle because the cut opens. So this is child's pose. This is ragdoll, when you hang forward. So for a couple of days when I have a cut, I cannot bend forward. We all know it as a kid. you know, your mom, we put a Band-Aid, we use your other fingers. A couple of days later, you take the Band-Aid off. Now it's not bleeding. Now it's time to introduce flexion of the finger. Same thing with the spine. This is the cut. I am like a large finger. If there is still ongoing problem, you know, I would encourage you, and not to be sarcastic, I would encourage you to think, if you're seeing these professionals and you're still experiencing issue, something must change, right? You're still dealing with this pain. So let's clean the slate. I will interview, I'll ask you a lot of questions. We'll clean the slate. We'll start adding things in. We'll create a plan. And then over time, you will notice you can get back to your activities, but you will learn to adjust your own spine in between chiropractic visits. I have great friends that are wonderful chiropractors and friends that are physical therapists. The important thing to remember is you're with us for 1 hour. And the rest of the day and the rest of the week, you're not with us. You have to learn to do certain things on your own to adjust your own spine. And that's the brilliance behind mechanical diagnosis and therapy. It's about time now, and the baby boomers are hungry. What can I do to allow myself to age? I'm trying to age without pain. I'm trying everything I can. I've done yoga and Pilates and P90X and Zumba, and I'm hanging upside down, and I'm swimming, and I'm stretching, and I strengthen my core, and I do you know, all these different methods, Pilates and yoga, but I'm still experiencing pain. Well, sometimes less is more initially, then we have to start building up from there.
So the next question is a really quick one from Elaine. She says that she's doing a lot of YouTube cardio videos these days and is wondering if we should be careful of jumping onto those type of videos if you have osteoporosis.
100% yes, with 7 exclamation points.
Great, thank you. And the next question comes from Dan. I'm wondering, when doing the side glide for the lateral shift, I'm leaning towards the pain rather than the usual away from the pain. Which way should I do it in this case?
Well, okay, so there's a couple of things that's a very involved question. In general, when someone has a lateral shift, upper body to the left, lower body to the right, they walk like so. In general, and again, you got to get an assessment because this is a more complicated case. But let's assume you are really just interested in knowing what to do. Imagine a wall. Let me turn this to the wall. So I'm shifted to the left. Now I'm standing where the trunk is shifted to the left. I'm standing with my feet about a foot away from the wall. My elbow is at 90 degrees at my rib cage, and I'm slowly starting to glide. Now, the pain is often, not always, the pain will be on the right side when you're shifted to the left. So you want to push the hips slowly to the left until you can hopefully centralize the pain, if you can reach the wall. And then the goal is to get you back straight. Once you're straight, then extension is often the next procedure. But to get into the intricacies of moving into the pain or away from the pain, that's more involved that we can handle right now, because there's more details I need to give you.
Thank you so much for that. The next question comes from Maris. I have neuropathy in my feet from a disc issue. I work through it, but are there any daily exercises I can do to help?
So I need to know if the neuropathy is constant or intermittent. Does it come and go, or is it always there?
So Maris, feel free to chat in the answer to that. He was asking, is the pain constant, or does it come in and out?
And while she types it back in, is there another question out there?
Yes, you just read my mind. I was going to say we have another question from Elaine that's a really quick one, which was, what about twisting exercises? There's a lot of those to strengthen your abs, and they require a lot of twisting. Are those okay or not okay? And again, she's been asking questions about osteoporosis.
I would be very careful with twisting. One of the culprits for back issues is bending and twisting. So you can be sitting, which is a form of bending. Let me lower the camera down a little bit. So you can be sitting and twisting, and actually you could, if again, you got to be assessed first, but if you're dealing with osteoporosis, Elaine, please first get an assessment, make sure you find your directional preference. After you found your directional preference and you feel better, then, you know, gentle twisting is you know, it's something we do in our life, right? Someone calls us, we turn around. But some of those machines, for example, in the gyms, where you get in and you twist, I will never touch them, because some of them are actually can create damage. So I would avoid it if possible, especially since you're dealing with some form of osteoporosis. You really want to be careful with that.
Great. And so Maris has added that, yes, the neuropathy pain is almost always there. It's constant.
Okay, since it's constant, it's constant. So we need to have an assessment. I need to ask a bunch of other questions to make sure we can help with her problem. She requires a more thorough investigation.
That makes sense. Essentially, as you all know, we want to be careful recommending things if you don't have all the details about what's happening.
Right.
So one other question we have that came through, and I don't see a name attached, so let me know if you can chat in your name, but it says, I sleep with the McKenzie roll under my neck, and I have been for 2 months. After doing McKenzie exercises all day, my shoulder pain is gone, but it starts to return approximately 10 minutes after I've laid down to sleep. To what could that be attributed?
So the McKenzie roll may not be appropriate. Possibly, you know, if you're able, first of all, if you're able to abolish your shoulder pain by doing the exercises, which is great, it shows you found your directional preference. You may need, as you're laying down, before you lay down, to do the set of the exercises, but there's probably a need to add one more exercise in to give you the best advice. I will need to talk to that person and do a session with them to figure out exactly what are they doing before they go to bed. I would like to see, hopefully now through telemedicine, it's amazing. I see it on a daily basis with patients. They're showing me, and I posted it also on my Facebook page on South Beach Spine Physical Therapy, how I can help patients. I can see how their car, how they're lying in their computer, you know, how they're shaving, putting makeup, all those things. Now through technology is easy to help a person. So I'm interested in knowing what is going on, possibly watching TV in bed or on the sofa, and then I'll be able to help further to know why it turns back when you're lying down. Maybe there's a need to take the cervical roll out, but I need to speak with that person.
Okay, great. And I see, Carla, you chatting in. So yeah, thank you. Feel free to touch base with Dr. Suprun about that issue, and I'll be sharing some contact information at the end. And we're about to wrap up, but we've got one final question from Mary Davis, which is, I've tried sleeping with a towel in the small of my back and ended up with a body ache all over my whole back. Comments? Thoughts?
Could be that the towel was too aggressive. Could be that you need first something softer. Get an assessment first. Make sure you do need something under your lower back. A lot of people may need something softer to start with. There's something called a nitrile. I don't have one in my office right now. Something softer. Towel could be too firm. A nitrile, let me show a picture of a nitrile. Actually, I have it here. A nitrile could be softer and more appropriate to start. Here we go. This is a nitrile. That's a McKenzie nitrile. You can order it on Amazon. So she's sleeping. It's fairly soft. It gets squishy. A lot of people, including myself in the past, I used to tell people, lie on your back with pillows under your knees, which feels good, but it doesn't fix the problem. So when I started to learn this method, I realized that a lot of people do benefit if they're not taking and putting pillow under their knees, but they're putting some kind of a support if they're having pain at night. If there's a need beyond doing the exercise, usually the exercises often help and people are able to sleep well. But if not, then there's going to be a need to use something softer. I had a patient a few weeks ago who was lying with something like so. It's very, very squishy. And you know, he woke up in the morning. He said to me, this was the best I felt in months by just putting something as soft as half a roll like this. It's completely squishy. It's not made out of the foam. It's not something like this. I will not encourage you to do anything firm like that under your back, but test it out. A towel could be a little too much.
Excellent. Well, we are coming up right to the top of the hour. And before I share some contact information about how you can schedule an appointment with Dr. Suprun, I'd just like to give you a minute, Yoav, to please just share your final thoughts with us.
First of all, I want to thank all of you for taking the time on Saturday to join us and to learn, which is the most important thing. My goal here is to create awareness. And once you have awareness, and we can progress you forward. I want you to know that hurt doesn't mean harm. People feel, including myself, I get recurrence in my neck. I get recurrence sometimes in my back. I do what I know to do, and I get myself out of, you know, weeks of problems. Mechanically in the method, and then this person will help you figure out what's your directional preference, educate you. You can always, if that doesn't help, you can always progress to other injections or medications, etc. But often, guys, the majority of you, all you need is movement. Movement is the best form of therapy for the body, and we are just not moving enough. And especially now, where so many of us are stuck at home, we need to move more. We need to align our house. We need to sit ergonomically correct. We need to understand the mechanics of the spine and the body. And now it's the time to learn and to apply it on your own body. So again, I'll be happy to assist you. We have a 50-minute sessions that you'll be able to schedule after this talk for the next few weeks. And I'll do my best to help you as much as I can. Thank you for joining us.
Thank you so much for joining us, Dr. Suprun. This information is so valuable.
Thank you.
And like I said to all of you, I'm going to share some information right now about how you can connect with Dr. Suprun. You can schedule private appointments with him by contacting Holistic Holiday at Sea's telehealth, either by email or by phone. You can see the information up here on the screen. But thank you all so much for being here. And Dr. Suprun, we really appreciate your partnership with Holistic Holiday at Sea and everything that you're doing to support people in their health. So thank you all so much, and have a wonderful rest of your Saturday.
Thank you so much, Sarah. Have a good afternoon.